Good morning, I'm Diane Macedo. Thanks for streaming with us. In today's update, congressional leaders could be close to reaching a deal on a COVID-19 relief package. The $900 billion bill could help millions of Americans struggling to stay afloat during the pandemic. The package is expected to include $600 stimulus checks for all Americans and weekly $300 unemployment checks. The U.S. Department of Labor now reports 885,000 Americans filed for initial claims of unemployment benefits last week, up 23,000 from the week before. Millions of people are in a winter whiteout this morning as a major storm slams the Northeast. Parts of New York are buried under nearly 4 feet of snow, and driving conditions are dangerous. Take a look at this close call in Pennsylvania. Those are 2 EMS crew members almost hit by a truck while responding to an accident. And the nor'easter is colliding with one of the biggest shipping operations of all time, potentially delaying COVID vaccine deliveries. UPS and FedEx haven't specifically said how the storm is affecting vaccine operations. Meanwhile, the FDA is set to vote on emergency use authorization for Moderna's coronavirus vaccine. But there are some new concerns this morning after 2 people suffered allergic reactions to the Pfizer vaccine. This as the U.S. reports its deadliest day on record since the pandemic started. A record 3,600 people lost their lives to COVID-19 yesterday. And now let's go to California, which is seeing record levels of cases and deaths. A top L.A. health official said hospitals there are, quote, under siege. Chief National Correspondent Matt Gutman has the latest.
This morning, patients on stretcher after stretcher, jamming ER hallways outside the traffic jam of ambulances that delivered them. Providence St. Mary's Hospital in Apple Valley, California, hasn't been below capacity for weeks.
I believe we have about 57 to 60 patients right now that are ICU level care in the hospital.
But how many ICU beds do you typically have?
We have a 20-bed ICU.
So they're basically you're at 300% capacity for your ICU.
Yes, that is correct.
Across the country, over 113,000 Americans are hospitalized with COVID, setting a record for the 11th straight day. And a new record also set overnight for deaths. A staggering 3,400 people. The nation's current epicenter, California, reporting over 53,000 new cases. Dozens have spent days waiting for rooms at this hospital, about 90 minutes from L.A. Many of them are desperately ill, and some, charge nurse Jamal Willis tells us,
every day,
are dying.
Just this morning, we ran multiple colds back to back. We had 3 cold blues at the same time. One of our doctors went up and ran those colds.
Meaning people were having a cardiac arrest?
Cardiac arrest. No pulse. And that's another one right now.
That doctor was Ramon Dillon, handling 10 code blues just Wednesday morning.
So you're literally scurrying between 3 patients who are essentially dying at the same time?
Yes, sir. Yes, sir. And we were successfully able to get them back. But, it's critical right now. This is kind of like it's like being in war. I've never seen so many code blues all in one shift.
But the hospital quality director tells us patient care is beginning to suffer.
When there are too many patients for too few nurses, it means you can't give the care you'd like to give.
That's correct, yes. And so we're doing our best. That is happening right now on every unit of the hospital.
And Diane, this entire hospital has had to reconfigure itself, literally reshaping itself to accommodate the massive surge of patients. Mostly COVID patients. So this is one of those overflow tents where they triage patients. They treat them if they are not contagious with COVID here. Inside, there is a lobby. Half the lobby is now a COVID ward. The operating room has now become part of the emergency room. There are still dozens of people lining the hallways waiting for hospital beds, and we're told that some of them have waited for days for this. So, this is definitely not going away, and the biggest concern at hospitals like this, especially in California right now, is that people will see that vaccination program as a green light to go spend the holidays with members of their family who are outside their immediate household, when the medical staff here says the darkest days are ahead. They're just begging people to stay home. Diane.
Good advice. Matt Gutman in Los Angeles. Thanks, Matt. And the winter storm has many schools closed in the Northeast this morning. And despite the challenges of 2020, one superintendent is trying to ensure a snow day still holds its magic. Dr. Bondi Shea Gibson from West Virginia even closed virtual school for students and staff yesterday, urging families to, for one day, ditch the serious business of growing up and instead play in the snow. And Dr. Gibson joins me now. Dr. Gibson, good morning. What made you decide to not just shut down the school building, but also cancel virtual classes too? Dr. Gibson, can you hear me? It's Diane. No, I guess we don't have Dr. Gibson, but highly recommend checking out and reading her letter advising parents that for just this moment, we can all enjoy this day together. And now we want to go over to Capitol Hill, where Senate Majority Leader Mitch McConnell is now speaking about the potential for a COVID-19 relief package. Let's listen.
In that respect, the situation we face now is familiar. Funding for the federal government is hanging in the balance. In the next few days, Congress will either succeed or fail at providing secure and stable funding for our military commanders, our federal departments, and key investments for our future. Fortunately, our colleagues on the Appropriations Committee and their House counterparts have been on the case. Bipartisan, bicameral committee work has full-year government funding legislation on the 1-yard line. I'm optimistic that if we can close out our other parallel business, we should be able to fund the government and move forward together. But that brings me to the way in which this year is unlike anything we've seen before. It's been more than 9 months since our nation began to feel the full force of the COVID-19 pandemic. The American people have done what Americans do when crises come knocking. Essential workers have kept our nation running. Healthcare professionals have worked day and night to care for strangers. Heroic American businesses have adapted, reinvented, and obeyed the advice of medical experts. Now we can see the light at the end of the tunnel, Mr. President. Operation Warp Speed has given us safe and effective vaccines in record time, but the American people need another bridge to those better days that are not so far off. The country needs Congress to come through with another targeted rescue package. They've waited months. They've waited and suffered, and some have died while needless political games have played out. The American people wait for more emergency assistance ought to be over. For months, I've called for a targeted bipartisan package that would put hundreds of billions of dollars into payroll support, testing, vaccine distribution, extended unemployment aid, safe schools, and other essential priorities. So I'm encouraged that our Democratic colleagues have now embraced this framework that's been the right solution for our country all this time, and a bipartisan, bicameral agreement appears to be close at hand. The outline that I've been discussing with Democratic leader Speaker Pelosi and Leader McCarthy would get another huge dose of bipartisan support out the door as fast as possible. We've yet to nail down every detail, but in broad strokes, we've been discussing the targeted second round of job-saving Paycheck Protection Program that Republicans have sought since last summer. We're discussing many tens of billions of dollars for distributing vaccines, COVID testing, and equipping safe schools to get our kids' educations back on track. We're discussing extended important unemployment programs. At the particular urging of President Trump and Secretary Mnuchin, who have continued to be the champions of cash relief for American families, we're discussing more direct impact payments for individuals, plus the bonus for families with children. These are just some of the major pillars. And equally important, Mr. President, we're agreeing to be smart about financing these extraordinary policies. Now listen to this. We intend to repurpose more than $400 billion in unspent funds, which we already allocated in the CARES Act. It turned out these funds did not need to be tapped to restore basic stability to our economy. It's time we put that money to urgent use. Like I said at the time yesterday, I'm heartened by our discussions and our progress. I believe all sides are working in good faith toward a shared goal of getting an outcome. But I will say this, Mr. President, in my judgment, we're very close to a point that arises in every major negotiation. It's the point where each side faces a fork in the road. Do we want to lapse into politics as usual and let negotiations lose steam? Do we want to haggle and spar like this would an ordinary political exercise, get wrapped around the axle of language or policy riders that we know are controversial? Or, on the other hand, after months of inaction, do we want to move swiftly and with unusual bipartisanship to close out our issues, seal the deal, and write text that can quickly pass into law? In short, we're near the point in this process where we decide if we're going to stay on the fast track or drift back toward business as usual. I say the answer should be obvious. After all these months, struggling Americans don't just need action. They need action fast. So I continue to appreciate our productive discussions, but I hope we also remember just how urgent the situation is for millions and millions of our fellow citizens. So for the information of all senators, we're going to stay right here, until we're finished, even if that means working through the weekend, which is highly likely. And if we need to further extend the Friday funding deadline before final legislation can pass in both chambers, I hope we'll extend it for a very, very short window of time. Our citizens can't afford for us to get bogged down in the back and forth. Let's finish up our bipartisan framework. Let's make law as soon as possible. That's what our people deserve. I suggest that, therefore.
The clerk will call the roll.
Mr. Alexander.
All right, that was Senate Majority Leader Mitch McConnell talking about the potential COVID-19 relief package being considered by Congress right now. And for more on this, I want to bring in ABC News congressional reporter Trish Turner, who's on the phone with us. Trish, McConnell addressed two big questions when it comes to this package, which is the two looming deadlines. One, you've got recess coming up for the holidays, but also this looming government shutdown.
That's right, Diane. So Friday night, tomorrow night at midnight into Saturday, they need to have this deal wrapped up. And COVID relief, anything that they pass, is supposed to be tacked on to that government spending deadline. So what you heard from the leader there was a warning to both sides. He's saying that while they're close, the biggest thing I heard him say was they are right on a very precarious precipice. So, right, government funding could run out. Stop any sort of partisan activities that are happening. If you have a pet project you want funded, he says they're at a fork in the road, and that's a big deal. So we understand that the language is being crafted right now, but he is also signaling that they are at a point where this could go either way. They're really close, but they could also drift into, partisan recriminations. So that was really important.
Trish, he sounded almost a little bit annoyed, like they're so close, yes. They have these looming deadlines, and yet, he was kind of speaking in broader terms, but it sounds like he's accusing some of the people at the table of nitpicking at this point.
You read him well. He's really hard to read. He has an annoyingly, this poker face, steady voice, but that is an annoyed Mitch McConnell. He's saying it was good that he said, I think all sides are working in good faith. But, yeah, when he says, we can go stop trying to tack on policy riders, this is, your pet project that you might want for something. But it might be something really important to a Democrat. They might want to add more in nutrition aid. And Republicans are really looking to keep the price tag down on this funding bill, this emergency relief, and also the stimulus checks. We understand that, these are going to be around $600. The qualifying income threshold, I understand from a couple of aides, there's still some bickering behind the scenes. Republicans want to lower that threshold where you would qualify for these checks. So if you remember in the first round in March under the CARES Act, everybody who made, less than $99,000 got some kind of $1,200 check or slightly lower. This time around $600, but I think they want to lower that $99,000 to something else. And so there's some fighting going on behind the scenes. That was an annoyed Mitch McConnell. It's time to wrap this up. because he doesn't want to work into the weekend, but he's very clearly saying, we're going to stay here, and it's highly likely that we're going to be working through the weekend.
So, and on that note, he's saying we are staying right here till we're finished. He made that clear and said that could mean working through the weekend, as you just mentioned. He also addressed the funding deadline, saying that he hopes if they need to, they can extend it for in his words, very, very short period of time. Can they get this done regardless?
Yes, I think absolutely they're going to get this done. I don't normally make predictions, till I think in this, they have tied themselves to this post. They're not leaving this chamber essentially, till they strike some kind of a deal. Now, we have been hearing that a number of members don't want to enact any sort of short-term government funding. They don't want to pass that and give anyone any breathing room. So that means a government shutdown, in the minds of some, is not such a bad idea. It's a terrible idea in reality, but they think that if something like that happens, it really keeps people at the table. It keeps the heel on the neck. Like, make sure you get this deal done as fast as possible. If you buy these, I've been doing this for a long time. If you say, all right, we're going to extend the government funding deadline through Sunday or Monday, they will absolutely take till midnight on Monday or whatever that deadline is to get something done. It's kind of like, some of us did with our homework, writing that paper at the very last minute.
So we could see this funding deadline as an attribute in that respect. It might help them get this done quicker.
Yes, exactly. It really might. And these guys hate to work on the weekends. So that's another, motivating factor is getting everything done, by the end of today. There still is hope for that. The number 2 Democrat in the Senate just a little while ago said he still thinks it's possible to get that done. And really important on this point, the extreme ends of the caucus of the Senate who want different things out of this, far left, far right, they had been threatening to hold this up for various reasons, but we have every reason to believe from aides and from the members that they're not going to do that. So this particular deal has an open highway to approval as soon as they can get it done. But the other thing that we're hearing is, writing legislative text, it takes a really long time. And so there's also a lot of that going on right now. And it just eats up hours and hours. I've been around for, through the night waiting for legislative language to come out on a short bill. And this thing is going to be gigantic.
Well, Washington working together. This is something we haven't seen in a while, so at least we can look at that as a bright side. Trish, if they get this done by Friday, how long do you think before people actually start receiving those checks?
That's a great question, and my colleague Ben Siegel was looking into this. According to a couple of sources, it'll take a couple of weeks at a minimum to get the machinery of government back up and running. We don't know about the holiday factor. The federal government's not open around the holidays. So we don't know if that, that'll create a little bit more of a delay, but certainly they have the muscle memory now built into the system where, they know the people who file their taxes. They have a straight line into their bank account with a coronavirus relief check. If you qualify, we went through all of that in the first round, all the just torturous, months of trying to get everything to work. Well, now they've gone through all of that, so we do believe it'll take less time this time around, but it's not something that I think it's safe to say, Diane, that we wouldn't see these checks in people's accounts for Christmas. We think that's a bit too quickly.
All right. Well, the clock is ticking. Congressional reporter Trish Turner, great to have you, Trish. Thank you.
Thank you.
And Senate Minority Leader Chuck Schumer is now expected to speak soon on Capitol Hill. We're going to bring that to you when it happens right here on ABC News Live, and we will have a complete wrap-up today at 3 p.m. Eastern on The Breakdown.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.